I would like to thank the organizers of the conference from the Changsha Women and Children's Hospital for extending this invitation to me to share my experience about use of Haifu in the treatment of uterine fibroids, particularly in our country, Nigeria. It's really a great pleasure for me to be sharing this. So I'm going to start sharing my screen. And so, like I said, yes, I'll be looking at what our experience has been in Nigeria in the last couple of months. Yes, Lagos is also known as the city of aquatic splendor because Lagos, if you know, is surrounded by water. So uterine fibroids are the most common benign pelvic tumors in women, especially in their reproductive age group, and approximately 70 to 80% lifetime risk of especially women in their reproductive age group. There are many management options for fibroid-related symptoms, and this include expectant management, medical therapy, non-excisional procedures like uterine artery embolization, and of course, Haifu, which we're going to focus on today, and of the old surgery, mammectomy, and hysterectomy. The factors that we consider in choosing the appropriate option for treating fibroids include the age of the woman, the symptoms, whether they're present or not, where the location of the fibroid is on the uterus, and then the desire for future pregnancy. During this presentation, what I'm going to be trying to do is to compare what is the present norm in Nigeria and probably now take a peep into what the future might look like in the treatment of fibroids. Right now in Nigeria, the commonest surgery for fibroid treatment in Nigeria is mammectomy. And the different prevalence in different parts of Nigeria, ranging from 75% to about 90% of patients who have fibroids in Nigeria. But as common as mammectomy is, we know that there's still many complications from it. The early complications, of course, include hemorrhage, the risk of blood transfusion, anesthetic complications, and sometimes inadvertent hysterectomy. That is, you did not plan to do hysterectomy, but you have to end up with hysterectomy. But there are some other late complications, like the fact that a woman can form embolus in blood vessels. And also sometimes the fact that after you've done your beautiful surgery, you come back only to see that there are intrauterine adhesions in the uterus, which still prevents the woman from getting pregnant. And again, the fact that some of these fibroids will recur. So what we're trying to do today is how we're going to take this leap from what the present is to what the future is like, because that is what Haifu represents. So the question usually is, what is Haifu? Because when you talk about Haifu, majority of the people, especially in this part of the world, have not even heard about it before. So Haifu is high-intensity focused ultrasound, and is a non-invasive technique that uses non-ionizing ultrasonic waves to hit or ablate tissues. If you look at the diagram I'm showing, or the picture I'm showing in front of you, you will see that there is like a converger slide, or through which you can converge sun rays, and then the spot on which you converge it can actually catch fire. And the same thing that Haifu does is that you converge, this time, ultrasound rays to a particular focus, and then that hits up that focus. Well, the history of Haifu been quite for a while. Actually, it was in the 50s that the Fry brothers in the University of Illinois attempted to do some neurosurgery using the ultrasonic waves. And but in 1994, the first Haifu machine, or the Stono blade, was actually launched in Europe in 1994. And the journey has been far until it got to, we're going to see what it looks like now with the advent of the JC200 in China. Okay, so this is the picture of myself and the person who developed the ultrasound Haifu and his team. This picture was taken in Singapore. Was when I came across the team for the first time, and one thing led to the other. Now we are where we are in Nigeria. I am really very grateful to this team for the wonderful support they've given us from Chongqing in China, and it's been marvelous every day. So this is the JC200. This is the machine that we have. And this is the machine probably now that is one of the commonest products from Chongqing, China, that we use to treat fibroids. And it's present in so many countries, in about 39 countries all over the world now, where this is used. How does Haifu work? That's usually the question. And like we said, it involves trying to converge ultrasound waves, and then where the focus is where it heats up, and it heats up, generates the heat of about 60 to 90 degrees centigrade at the focal point, which causes irreversible coagulative necrosis at the target tissue. The question most of the time is Haifu for everyone? And we say no. We look at it from the contraindications to Haifu, which we can look at from the relative contraindication to the absolute contraindication. One of the challenges we have, which makes it a relative contraindication, is women that are obese, that overweight. So what we do in Nigeria is to take the cutoff as 120 kilograms of body weight. And from there, when we say relative contraindication, it means we're not saying that we cannot do Haifu. We're saying we need to be very careful and probably do a simulation before we can recommend whether such a patient can do Haifu or not. So the other people are people who have had surgery before, who have had the midline vertical incision, patients who have type 0 or type 7 fibroids, and for reference, I'll put the figure classification of fibroids on that's the diagram you're seeing. So patients who have pedunculated subserous fibroids are usually a tricky one with Haifu, because the fibroid could drop into the peritoneal cavity. And also patients who have the type 0, the pedunculated intracavitary fibroids also are a tricky one with Haifu. Patients who have a history of abdominal liposuction are tricky. Patients who are not suitable for analgesia and sedation are also tricky. And patients with communication difficulties are patients we really might not be able to treat. Yes, but there is a group of patients where we cannot treat them with Haifu at all. Either we're suspecting that the fibroids are undergoing malignant changes, either because of what we can see on ultrasound, or when we are even suspecting malignancy in anywhere in the reproductive tract, either that we're thinking there might be CA of the ovary because there's a cyst we cannot really explain, then such patients should not have Haifu. And that's because we cannot have samples to be tested histologically after Haifu. So we avoid cancer of the reproductive tract like hell. Now, also patients who cannot lie in prone position for at least 1 hour because of orthopedic diseases or other causes also we cannot do Haifu for them. So I'm going to share for the next couple of minutes what our experience has been. In the last 15 months that we've started doing Haifu, actually we've treated 181 patients, but I'm going to just take you through the first 142 patients that we did. Out of this 142 patients, 116 or 82% had fibroids alone. And 20 or 14% had adenomyosis coexisting with fibroids. And about 6 or 4% of them had adenomyosis alone. So the incidence of adenomyosis in this group of people is about 18%. But when we look at the fibroid, the characteristics of the fibroid lesion, we see that 87% of these patients have hypointense lesions, and that means they're good candidates for fibroids, for Haifu. So this I just MRI images to show what the hyperintense fibroid lesions look like and the hypointense. Like we said, 87% of our patients have the hypointense fibroids. And this MRI images to show adenomyosis and then fibroids together with adenomyosis. Now, back to our patients, the age group has been between 24 years and 50 years, and 53% or 76% of these patients have a history of infertility. So you will see here in our patients that there seems to be an association, or if you like, it's infertility is very common in the patients that we treat with uterine fibroids here in Nigeria. This is looking at the treatment. On the left shows the MRI before the treatment, and then on the right shows after treatment and the ablation rate. So let's look at the shrinkage rate, because we know that Haifu does not remove fibroids, but it causes shrinkage of the fibroids. So we're looking at the group of people that have had 3 months follow-up, 6 months follow-up, and 9 months follow-up. And the average shrinkage rate had been about 35% after 3 months, 47% after 6 months, and 57% after 9 months. Now, we are looking at the patients that have had hysteroscopy after Haifu. Now, in our center, because we are also able for type 0 fibroids, so we try to do hysteroscopy for them. So 26 out of these patients have had post-Haifu hysteroscopy. 6 of them was just diagnostic because they were preparing for IVF. And then 20 of them had a myomectomy for submucous fibroids. In other words, what we're doing is combining, for people who have submucous fibroids, we're combining hysteroscopy together with Haifu to treat their fibroids. Out of these patients who have had hysteroscopy, one of them who had fibroid coexisting with adenomyosis is pregnant now, and she's about 18 weeks. A total of 4 patients have had Haifu, have had IVF after the Haifu treatment, but this patient is pregnant now. One of them did not have IVF with us, went somewhere else, so we are waiting to get the result from her. But one of her, we've had after Haifu from our patients. Okay, out of the 142, 21 women complain of lower abdominal cramps. These are just immediate post-op complaints, which most of the time they're normal because they go away immediately after the treatment. In other words, we've not really had any major problems from using Haifu on our patients. Well, we just go over some of the complaints that we heard. 3 women complained of transient leg pain, 7 complained of lower back pain, 16 women complained of skin burning sensation, but no skin burns, but just skin burning sensation. So those are some of the complaints that we heard immediately post-op. So let's complaints. 10 women complained of heavy menstrual bleeding after the Haifu, which we told them that this could happen immediately after Haifu. After the 3rd menstrual period, everything became normal again. 4 of these patients had adenomyosis, and 6 of them had treatment for type 2 to 4 fibroids. 10 women complained of mild watery vaginal discharge. 1 patient had mild skin burn, which just went away, healed after dressing. And 1. So in conclusion, I would say that Haifu is a very good alternative and is well suited for our own patients with uterine fibroids, as majority of the lesions that we see are hypointense, as we saw, about 83%, and they are also associated with infertility. And even the figures that we got here has shown us that the AMH, anti-Mullerian hormone, is not affected by treatment with Haifu. And what actually we see that it's going to be a major advancement over time is the treatment of adenomyosis. We think Haifu is likely to become the first choice for treatment of women with adenomyosis, especially those who are still desirous of future pregnancy, who are not ready to have a hysterectomy. We know we need to gather more data in order to be able to convincingly say this, and that's why we're calling for more randomized controlled trials in order for us to be able to tell the whole world that we have this armamentarium with us that can actually be the first choice for women with adenomyosis. Yes, all I just have to do now is to thank you so much for listening, and especially to thank my interpreter for doing such a wonderful job. Thank you.